Welcome everyone. This is really the beginning of what looks like a very engaging and exciting day, the celebration of the 10th anniversary of the Social Justice Institute. I'm Tim Black. I'm a professor here on campus in the sociology department. And I was the interim director when Dr. Rhonda Williams left, and then became the co-director with John Flores. So I served in that capacity for 3 years. John Flores will be speaking later today on immigration, and you don't want to miss that talk either. John was my colleague and friend and co-conspirator, and so we had a good run with the Social Justice Institute, and now we've stepped down, and Mark Chupp and Aisha Hardaway are going to be moving this forward. It's really, really important space. I can't say that enough, how important this space is on campus. So welcome. It's great to be kicking off this day. I wanted to introduce also my co-presenter, Crystal Tascon, who is a senior sociology major here on campus. I teach a course on what's entitled Racial Inequality and Mass Incarceration in the United States. Crystal took this course 2 years ago, became very interested in the issue and very committed to the issue, I should say. One of the speakers who came to the class, who is a research partner of mine, who's formerly incarcerated, a person who's doing really terrific anti-violence work in the city, Damien Calvert. Crystal worked with Damien after taking my class for about a year, shadowing him doing some of this anti-violence work. She's also done some work in the Cleveland community-based corrections facility. So she approached me at the beginning of the year and said she wanted to do an independent study. And so we decided, after a series of conversations, to focus, given the moment we're in, to focus on the COVID-19 crisis in the prisons. And so what we're basically doing today is we're just inviting you in to our process, inviting you into where we are with this at this point. I mean, this is all very preliminary. This is all sort of emerging and unfolding as we talk. This is research in real time. So, we're into it about 6 weeks. We're culling together data wherever we can. We're following media reports. We're talking to a few people. We've talked to a few people who are on the ground doing work on this issue as well. So today, what we're really doing, the purpose of all this work, for me anyway, is always, we're going to address the crisis in the prison. We, of course, our interest is in continuing and accelerating the decarceration trend that's occurring in the United States. And of course, ultimately, we always are trying to keep our eyes on the prize, which is the transformation of our socioeconomic system and our criminal justice system. So we always see the work that we do as part of that long-term goal. We don't have the answers right now, but we're here to show you what we've been learning, to invite you to share what you know, and to try to advance a conversation and a strategy for moving forward. So I'm going to share my screen, and we're going to get started here. Can you see that? Yeah, okay. Okay. So let's start with some good news. When I mentioned this decarceration trend, this chart kind of lays out this period of mass incarceration that we're living from. Between 1925 until the mid-1970s, we locked up about 100 out of every 100,000 adults in the United States. But you can see this period from the mid-1970s until it peaks in 2008 is a period that we call mass incarceration, the period of really sweeping up large numbers of young men and women, throwing them in prisons, warehousing them. This is the period in which the prisons went from being predominantly white to predominantly Black and brown. It is our period of disgrace, I would say. It is a period that will define, it's a historical marker. It will define this era. We are, of course, the leading carceral state in the world by far. We have about 4% of the world's population. We lock up about 25% of the world's prisoners. As you can see, however, and I'm using my pointer here, we've started to move in what I would say is the correct direction, the right direction. So we are seeing this decarceration trend. So just to give you a few numbers on that, the incarceration rate has fallen from 2008 to 2018 by 15%. The greatest decrease has been among the Black population, with there's been a 28% decrease, a 21% decrease among the Hispanic population, and a 13% decrease among the white population. So we are moving in the right direction. The politics behind this is very odd. It's very strange. We have strange bedfellows who are working towards decarceration. It includes fiscal conservatives, and libertarians, and progressives. I attribute a lot of this work to the activists and to the advocacy groups that have been working so hard on this for so many years. So we are moving in the right direction. However, we of course have a long way to go. And I don't want to present too rosy of a picture. And this gives you an idea that you know, even in 2018, if we were to combine those who are in jail and in prison and in pretrial detention, we far exceed still any of our peer countries. And despite the fact that there has been this decrease in the Black and brown population, still today, Black men are almost 6 times more likely to be incarcerated than white men, Black women about 1.8 times more. For the youngest group, the group 18 to 19, Black males are 12.5 times more likely to be incarcerated. So obviously, while we're moving in the right direction, I don't want to present too rosy of a picture. We have a long ways to go, particularly if we really are going to try to take the mass out of mass incarceration. So this is 2020, what our incarcerated population looks like. Let me just, there's a lot going on in this. Let me just point out a few things. First of all, we lock up most of our prisoners in state prisons. That's what this turquoise slice indicates. These are the ones, this is the percent that we lock up in local jails. And this is the federal prison rate, which is the federal prisons. And this is the smallest of those 3 jurisdictions. One of the things to point out from this graph is that, you know, one of the reasons why we're seeing this decarceration movement across states is that there's more diversion programs, more alternatives to incarceration programs. There are more drug courts and so forth. The focus has really been on drug offenders. And what we have seen, in fact, we have seen a precipitous decline in the number of drug offenders that we are incarcerating. So that now, that percentage of all state and federal prisoners is below 15%. That's a significant accomplishment. But one of the reasons why, I mean, the conversation around decarceration has really focused on what Marie Gottschalk calls the 3 nons. That is the nonviolent, the non-serious, the non-sexual offenders. And so that's where we have seen the most movement here and the most success, I guess you would say, in terms of decreasing, you know, that population inside our prisons. As I said, below 15% of drug offenders, and only 4% of those are in for possession now. So this is a real accomplishment. But one of the problems has been that as we have focused on nonviolent offenders, we've created this binary, and in doing so, I'm afraid that we have also contributed to the demonization of violent offenders. And if we're really serious about decreasing our population, we're going to have to tackle that issue. So if you look at this group right here, This is the group in state prisons that are locked up for violent offenses. Over half, about half, I think it's 56% in 2020 were locked up for violent offenses. Now, violent offenses includes a lot. I'm not going to get off on that today, but you know, it's a big umbrella. It includes a lot of different offenses. So you know, if we are, I'm bringing this up now. We're going to come back to this a little later. So, you know, how is it that we could, I think, you know, one of the unstated, you know, when we talk about mass incarceration during the 80s and the 90s, we talk, you know, what is it that created it? Well, we arrested more people, we incarcerated more people, we increased mandatory minimum sentencing, so the sentences were longer, and we required prisoners to stay in prison longer, to serve 85% of their time. So if you put those three factors together, you can see how it is that the prison population has swelled so considerably. But one of the things that's been understated is while we focus a lot on the mandatory minimums for drug offenses during that time, we were also increasing mandatory minimums for all offenses, including violent offenses. So we are locking up violent offenders for much longer periods of time as well. And of course, we also exponentially increased the number who we are locking up for life without parole. So this, in order to really address the population of violent offenders and begin to figure out how it is that we're going to decrease the population of violent offenders to continue this trend of decarceration, we need to start that conversation. Okay, but the pandemic, of course, the coronavirus pandemic has opened up an opportunity, you know, to continue a conversation around decarceration. So let's you know, it's a crisis. People are getting sick. People are dying inside the prisons. But you know, here is an opportunity to really push again on this issue of decarceration. So well, nationally, pandemic, as we know, over 8 million cases in the United States. Just as with mass incarceration, this has become another phenomenon of disgrace in the world. Over 200,000 deaths. Inside the prisons, it's interesting, this map was updated on August the 12th, but even since then, we now have over 200,000 cases in the prisons, and we are right around 1,300 total deaths. If you look over here on the right-hand side, you'll see that Ohio has the third largest number of cases, or the fourth largest number of cases, and the third largest number of deaths in the country. This map is, this one is taken from the National Academies Press that just released a report, if you're interested, on decarcerating correction facilities during COVID-19. The green line here, this is interesting because it is a rate based upon 100,000 population. The green line refers to the general population. The red line refers to the prison staff who have been infected, the rate of prison staff that have been infected, and the blue line is the rate of prisoners. So you get some sense of the magnitude of the infection rates inside the prisons. You know, why is this happening? I mean, prisons are like incubators for this infection. And the reason is because, one, overcrowding, this period of mass incarceration that I just showed you on the earlier graph, you know, even though we were building prisons at a rapid rate in the 1990s, it could not keep up with the numbers that we were incarcerating. Our prisons are way over capacity. They continue to be over capacity despite the fact of the decarceration. The ways in which people are housed inside the prisons, there's a lot of prisons. The pandemic has really exposed this to the public, that there's a lot of dormitory housing. You can imagine 300 or 400 men or women in one room, sleeping in bunk beds that are about 3 feet apart from one another. I mean, this is an incubator for this infection. A lot of the cells, they've doubled up and tripled up prisoners inside the cells. So That's the first, overcrowding. The second is the turnover. There's about 600,000 prisoners that are going in and out of prisons every year. So we have a lot of movement, the possibility of the infection being transferred. In the jails, there's about 10 million men and women who go in and out of jails every year. The physical design of the prisons, a lot of these prisons are old, the ventilation systems are horrible. San Quentin's getting a lot of attention these days. And we can come back to that a little later, but I mean, that prison was built 168 years ago. So it gives you some idea. There's a lot of very old prisons that certainly are traps for these infections. And then of course, our poor healthcare capacities in the prisons. Healthcare capacities vary a lot across prisons, but these 4 factors alone really enhance prisoner vulnerability and explain it basically has created in many ways what I think is the perfect storm. Now, wherever you find these kinds of these kinds of conditions, wherever you find oppression, you find resistance. And in fact, here's a map that has mapped out just for 5 months from April and through August, the numbers of uprisings and resistances within the prisons, inside the prisons throughout the country. Let me just make a plug right here before I go on. So we're going to be addressing this issue. We have a colloquium coming up on November the 11th, a panel presentation. And you're not going to want to miss this. It's November 11th, a Wednesday from 5 o'clock to 6:45. We're going to have a group of scholars and activists from across the country who are doing cutting edge work on this issue. The title of it is Prison Resistance: Inside-Outside Movements to Transform U.S. Prisons. So we are going to expand on this issue, and the discussion will really be about how movements can help to address this crisis that we're in now. But just to give you a sense, so the uprisings and resistance just during this 5-month period, this group Perilous has been tracking this. There were, and when we talk about actions, we're talking about hunger strikes and food strikes and protests and sit-ins and work stoppages and attacks on guards, a few attacks on guards. There were 137 of these events during this period of time. And I guess the question I would ask is how many of us know about these? Right? If I were to start this and ask you, how many of you know about these uprisings that are occurring in the prison? My guess is most of you do not know. And this has a lot to do with the problem of access. These prisons are so sealed off, a number of court cases under the Rehnquist court that has prohibited media access to the prisons. It's very hard to get access to these public institutions. And I really want to underscore that. These are public institutions and we should have access to these institutions. And so it's the reason we don't know. And of course, it prohibits us from being able to develop better inside-outside strategies to address what is truly a crisis that is killing people on the inside. There's a lot of resistance going on in the state of Ohio, and I want to call out some of that. The Ohio ACLU. There's the usual folks, and the Ohio Organizing Collaborative, Policy Matters, Ohio Justice and Policy Center, the Kanimu Center, the Jail Coalition. There's so many others. There's some new grassroots organizations that have sprung up around this issue. The Ohio Prisoners Justice League, it's led by Chastity Bauman, are doing just incredible work on a shoestring budget. Started with a couple of women who had men locked up in the facilities, and now it's grown to over 1,000 people. There's another one, the Prisoners Abolition Prison Support Group, and many others. So there's a lot of work being done on the ground in Ohio, and a lot of ways in which, if you're interested, you can get plugged in. We can develop ways of trying to support these groups. All right, I'm going to kick it over to Crystal, and Crystal's going to talk about about some of how the COVID virus is affecting Ohio prisons. So we're going to narrow down into Ohio shortly.
Yeah, okay. So as we can see, these are as of last week, these are the top 5 COVID hotspots in the country. And we can see that Ohio has 2 out of the 5 hotspots in state prisons, Marion and Pickaway. Marion has 2,446 cases of COVID, and Pickaway has 1,795. So it's important to point out that there were protests, as Professor Black was saying, and these protests put pressure on Governor Mike DeWine to make some sort of response. So between April 3rd and April 7th, Governor DeWine asked for the commutation or early release of a little less than 250 incarcerated individuals. This response was very tepid and not adequate, considering that at the end of February, Ohio state prisons were at an 132% capacity or 32% over capacity. Next slide. So this chart right here was compiled using the ODRC's COVID-19 testing data and the ODRC's 2020 census report. It shows 6 out of the 28 state prisons in Ohio. And then all of these correctional institutions have at least a 10% rate of infection. This rate was computed using the number of inmates currently positive with COVID, the number that have, and the probable and confirmed deaths. So another thing that I wanted to point out is this number of inmates in isolation. What I've learned is that after there's no more room in infirmary rooms, they place incarcerated people experiencing COVID-like symptoms in solitary confinement for 14 days. This is incredibly obviously disheartening and detrimental because many of these incarcerated individuals do not want to reveal if they're experiencing COVID-like symptoms because of this punishment. Being put in the hole, as it's often referred to, comes with extra restrictions. And on top of that, they're not receiving great medical care and they're being placed in a room with no windows and little human contact. So as we can see, Marion and Pickaway have extremely high rates. Marion has about a 90% infection rate, and it is a correctional institution. It's a medium security prison located in Marion, Ohio, that houses adult males. In addition to medium custody inmates, minimum security offenders are also housed here. And currently there were about 2,550 inmates at Marion, although the intended capacity of this prison was only 1,452. So again, it was above 150 capacity by the end of March 2020. Pickaway has an 85% infection rate, and it's located in Orion, Ohio. It's also a mixed custody facility, primarily of minimum and medium custody offenders. It was designed to hold about 1,328 people. And as the pandemic began in mid-March, it held 2,047. So again, an 154% capacity or 54% over capacity. So as Professor Black was mentioning, both Marion and Pickaway have dormitory style housing where between 300 and 450 people are sleeping in a room with bunk beds. Most have about 3 feet between each bed, if that, which again is, half of the CDC's recommended 6 feet of social distancing. So both the overcapacity of these prisons and the housing type have fueled these high infection rates in the prison. I'd also like to mention that there have been reports that COVID cases are rising in Richland Correctional Institution, although that's not on this chart. Next slide. Okay, so those were the state prisons. Elkton is a federal prison. So it's a federal prison. It currently has 978 recovered individuals and 9 COVID deaths. It's a low security prison located in Elkton, Ohio, and it also has a dormitory style housing, which means again they're tightly packed together in sleeping areas. It also means, for example, when they pass each other in the hallways, they have to turn sideways to pass. So Elkton is important because the ACLU of Ohio actually filed a lawsuit on behalf of inmates at this prison. And the ACLU of Ohio rarely gets involved in prison condition lawsuits, but they took on this case. So they filed a habeas corpus on behalf of the inmates that their detention is unlawful on the grounds of the 8th or 10th Amendment claims. The Constitution prohibits cruel and unusual punishment and thus requires respondents to provide safe and adequate living quarters, including protection from dangerous infectious diseases. And Elkton is not equipped to provide safe housing because of their inability to social distance these incarcerated people. So the ACLU of Ohio created this medically vulnerable subclass, and they defined it as all current and future persons incarcerated adults over the age of 50, as well as all current and future persons incarcerated adults of any age who experience illnesses that make them vulnerable to COVID. So these illnesses include chronic lung disease, asthma, heart conditions, conditions that can cause a person to be immunocompromised, such as receiving cancer treatment, smoking, organ transplantations. It also includes people who have poorly controlled HIV or AIDS, severe obesity, diabetes, chronic kidney diseases, or even liver diseases. So the district court actually sided with the ACLU and demanded that the BOP compile a list of the medically vulnerable people that would be eligible for home confinement or compassionate release. And the prison official actually compiled a list of 837 inmates. However, the ruling got appealed by the Sixth Circuit Court. So they ruled that that a prison official's deliberate indifference to a substantial risk of serious harm to an inmate violates the Eighth Amendment. However, there's two prongs to this deliberate indifference. The first is that the conditions pose a substantial risk of serious harm. And second, that officials must know of and disregard the risk to inmate health and safety. So the court believed that the first prong was easily met because the conditions were dangerous. However, on the second prong, the court argued that the prison had implemented a bunch of measures to combat the spread of the virus, so it can't be said that they were disregarding the threat. And they went through several cases of what constitutes a reasonable response and agreed that the prison had met the standard. So they ruled that the district court vacated the earlier decision, meaning that none of these people were actually released. And so this case is like particularly important to us because it deals with this like elderly population and those with medical vulnerabilities.
Okay. Thanks, Crystal. So just building on what Crystal said, this is this is a table again that comes from the National Academy's report. And so while the period of time in which the data is tracked for this data is limited because the state prison data ends in May 1st. Nonetheless, if you see the numbers of prisoners who have been released or the decline in the population as a result of the pandemic, it's interesting here, and I'm not going to go into this table a lot, but I want to point out that the state prisons, of course, as you remember, is the jurisdiction that holds the most prisoners. The decline has been really tepid. At least in the early parts of the pandemic, especially compared to the jails and the federal prisons and the immigration. Now, of course, there's more to be said about all that. Immigration, a lot of that decline had to do with deportations and deporting people who were sick back to their home countries. Some of the jails, there were release of pretrial detentions, but some were transferred into the state prisons. So there's a larger story here, but nonetheless, the point is that in the state prison response by DeWine's response, it would appear was fairly typical among many state leaders across the country. And that is that there's been a real reluctance to release state prisoners. This is what our friend Melekti Meliku from the ACLU describes as institutional denial. And I think that's a good concept, right? That what we've seen has been a form of institutional denial. So let's transition to the question, what can we do? And this is where we really want to brainstorm, right? What should we be doing? And Crystal and I have a few ideas on this, and we would of course open it up and invite others to share any thoughts that they have about this as well. I mean, first and foremost, it seems to me that we should be supporting groups on the ground. We're hearing alarming things from these folks on the ground, right? And it's information that contradicts the information that's available through the institutional authorities. As Crystal pointed out, we're hearing that right now there's a real hot spot going on at Richland Prison, that many of the prisoners are sick, that almost all of the staff have contracted the illness, that it's a real serious concern. As she pointed out, the healthcare, the ways in which those who have the illness, the virus, the ways in which they are treated. If there are not units available, medical units available, very often they're put in solitary confinement. They receive minimal medical care. These are some of the reports that we're hearing. So there's a number of things that people who have their ear to the ground are hearing, and we need to move in and try to corroborate some of that information. We need to help get attention to some of this information. Those of us who are in places like universities and in other spaces, nonprofits and so forth, we need to be working together with those on the ground. We need to take our lead from them on what it is we can do and to be helpful. Secondly, we need to demand transparency. Like anyone who's heard me give talks over the years about incarceration, this is one of my soapboxes lectures, right? That these are public institutions and we need to have the media in there. We need to have public access to these. And of course, this requires challenging a number of court cases, court decisions during the Rehnquist era that limited access to these public spaces. And I'm just not sure anymore to what extent judicial strategies are going to be effective given the current appointments of federal judges throughout the country. But nonetheless, we have to keep working on this. We need to demand transparency. Third, and this is where Crystal and I are right now. So third is we want to center a conversation on the most vulnerable populations inside the prison. We think this might be an effective strategy for a variety of reasons. It's not new. In fact, the group on the ground, the Ohio Prisoners Justice League, they led a campaign early on. It was called 20K by May, in which they were pressuring the governor to release 20,000 prisoners. They had information that there were about 15,000 immunocompromised prisoners throughout the state. And then they were also asking for or requesting for another 5,000 to 6,000 prisoners who had 2 years or less on their sentences to be released as well. Of course, they didn't get anywhere with this. It was a valiant effort to try to draw attention to this issue. We think that there's a lot to be said about trying to focus on this population. I think in some ways it might be similar to the strategy on nonviolence, right? That if we can identify the sort of older and those who are more medically vulnerable, that this might be something that has some appeal to the public, that we could appeal for compassionate release of this population. And it also, here, let me, so, clearly those who are in prison and in jail have higher rates of a variety of different chronic conditions, including high blood pressure, hypertension. So here's a good comparison between prison population, jail population, general population on a variety of chronic conditions: high blood pressure, hypertension, stroke-related problems, diabetes, heart-related problems, kidney-related problems, asthma, many of those that Crystal mentioned earlier. So trying to get information on the numbers and identifying the population who are susceptible to the virus, who are immunocompromised, would be one part of this strategy. I think it's important to recognize, and this chart here shows the changes in the Ohio prison population between 2009 and 2020. Now, the first thing to point out is that our population has declined from about 50,000, a little over 50,000, a little over 48,000. That's a small decline, particularly in comparison to the numbers I provided earlier in terms of the decarceration trends. That's about a 3% decline. And if we look at those who are of the elderly population inside the prisons, we have, here is in 2009, they made up about 16% of the population. In 2020, they make up 20% of the population. That's 1 in 5 Ohio prisoners are 50 years and older. So part of what our strategy is, we're thinking, is to try to identify bring some attention to the older population, bring some attention to those who are immunocompromised. And we also, the purpose here is not just, we want to make appeal for compassionate release, but it also opens up a couple of other conversations that we think this strategy might be useful. One is, a number of we suspect that a lot of this older population, that these are not new admissions, that these are men and women who have aged in prison. And so the thinking on this is that this is also a way of cracking open and having a more public conversation about those who have been locked up for long periods of time for violent offenses. I give talks, I've given talks in Lorraine and Grafton prison. And I have to tell you, one of the saddest things is to see in Grafton, to see these men who are in their 50s or even in their 60s, who are locked up for violent offenses that, occurred 20 or 30 years ago. And it's kind of inconceivable to think that these people are the same people that they were 30 years ago. Most of us are not the same people we were 30 years ago in so many ways. I think the idea of trying to identify this population, even those who are, of course, have been locked up for violent offenses, and to begin to make this appeal for release and to have a discussion about ways to do that in safe ways. So, focusing on the medically vulnerable also has perhaps the opportunity for trying to address how to reduce the numbers of men and women who are incarcerated for violent offenses. And then the second consequence of this, or second sort of direction of the conversation, is also what to do when we release people. And my work focuses mostly on reentry issues. If we're releasing people, and right now is a good time to be having that conversation, because if we're releasing people who are immunocompromised, if we're releasing people who are elderly, if we're releasing people who need healthcare treatment, it's a good time to be asking some questions, asking some questions about how is it that we transfer this population into safe conditions. And of course, this draws attention, in my mind, it draws attention to three institutions: to housing, to healthcare, and then also to income, right? Because and these are all things, by the way, that the pandemic has drawn attention to, right? Our failed systems of our public health system, our failed system of our social welfare system, failed housing system, and so on. I mean, so we need to, this is another opportunity to really focus on those institutions. So our thinking is that by focusing on and trying to draw attention to an older and medically vulnerable population, that it's not only does it contribute to sort of the decarceration trend, does it have public appeal, but it also has the potential for opening up these other conversations about violent offenders and how long should we be locking up our violent offenders. We lock up our violent offenders far longer than any of our peer countries. And then also about these institutions that the pandemic has demonstrated have failed. I mean, we have so much evidence about the failure of neoliberal capitalism during this pandemic. And this is another way of drawing some attention to that. So let us stop there. What do we have? About 20 minutes or so. And I'm going to stop sharing and bring everybody into the screen here. And so let's just open it up. And, what are your thoughts on this strategy? Does this make sense to you? What other kinds of things do you think might make sense? Any questions you may have for Crystal and I? I see Malekti has joined us. Oh, that's terrific. I couldn't see who was here earlier because I had the screen on, so now I can see who's here. So it's good to see Malekti. If you be interested in your comments, Malekti was very helpful to us in some of the feedback that she gave us earlier as well. So, but we're open. So whoever is interested in, the floor is open.
So I'd love to start. This presentation was so thorough, so eye-opening. I know it's so difficult to acquire some of that information, including the number of immunocompromised folks in the prisons, which at the time was nearly impossible to get an adequate number because it was ranging somewhere from 800 to 1,000. And lifting up the data that you said, we knew that there was a large percentage of folks who were in our prisons, and we knew folks who were in the prisons that were there for 20 plus years, but we didn't have that medical history or just the scope. So just thank you for putting those numbers out there. And I want to lift something that you said: 1 in 5 prisoners, in Ohio's prisons are, you said, over 60 or
50.
have been there for 20 years plus. I think that's the conversation that we need to lead with. I think because this conversation about public expenditures around the prison, we're as taxpayers paying for that medical treatment, even though it's subpar quality, and we can talk about the unconstitutionality of that. But as taxpayers, we're caring for those folks. So there are different ways that we can do that that are more cost effective. Produce less harm, reunify families, contribute to the economy. So there's so many conversations that I'm thinking of just coming from this presentation. And so I appreciate that. And I want to, my other question is, how did you find that 1,500 number around the immunocompromised folks? Was that from public records requests? Was that from just conversations? How did that final number materialize?
Crystal, you want to answer that? I think you're muted.
No, well, we found the 15,000 number we got from Chastity Bowman, when we talked to her. She mentioned that she got a hold of, I think, some form of public records. What was it, Professor Bly?
This is a number we have not corroborated. This number. I mean, this is one of the things that we're going to be. This is a conversation we're going to have with the ACLU and the Ohio Justice Center. We want to figure out how we can corroborate this information. Now, I know the ACLU was able to get some of this information out of Elkton. You guys were able to identify the medical vulnerable population in Elkton. How did you get that information?
So this was when the court ordered that the Bureau of Prisons actually come up with that list of medically vulnerable people to transfer. They came up with a list of around 860 something folks that we couldn't see. It was sealed from us, but we found that number fairly low with the criteria that we listed. I mean, the age criteria, the chronic health conditions, the rates of asthma and hypertension that exceed, many folks that are in their 20s and 30s in the prison. So we found that number very low. So, although that number needs to be corroborated more, it makes more sense than just the 800 that we 100% knew had some sort of condition. And those were the extreme cases because the BOP had an incentive not to identify as many people who actually are captured within that criteria. So I found that number very low, but it's continued to be an issue for us.
Other comments, questions? Aisha, I was going to be knocking on your door. I know that you're working you're leading up the social justice clinic, and I'm trying to learn a little bit more about why it's so difficult to get access to the prisons and issues around transparency, and I'm curious about legal strategies.
Yeah.
So I was, I guess I was going to be knocking on your Zoom door fairly soon.
Yeah, no, I hope that you do. There's a lot of work being done, at least on the federal side, around compassionate release, right? And then a lot of conversation here locally, right, around how quickly so many people were released in March, and how easy that was to do. And then I think in a lot of ways it made folks in power clam up and start to be less cooperative in some ways with releases, but there are definitely some legal strategies that the law clinic has been, there's a public defender who's a case alum, Jeff Lazarus, who's really leading this effort on the federal side. And I'll be happy to introduce you to him. And I'm sure there's some folks I could think of on the state side. I've been having some conversations with the administrative judges, and that has been helpful. But obviously the public defenders are overloaded in a lot of respects, and we know the transmissions in Cuyahoga County Jail alone are, as you talk about transparency, right? We're just hearing about them word of mouth. There's no real disclosure around. You hear about the staff, but you don't hear about the people who are locked in there, and what's going on with the infection rates nearly as much as you do with the staff. So I'd love to talk with you about that.
Yeah, you know, it's interesting. It seems in their prison population, their jail population during that time, and so did some of the other jails, right? So this is where we saw particularly the largest decrease. Yeah, I think DeWine's response was really tepid. There weren't many that were released out of the state prisons. But in the county, the reason that this seems like it may have been somewhat illusory is that what we're learning is while there was some release for pretrial detainees, and there was the courts really kind of slowed down the admissions to the jails. Nonetheless, a lot of those were transferred into state prisons, is what we're learning. And this was true in Cuyahoga, and it was true. There were 3 other counties that I don't have those in front of me, Hamilton, Lincoln, and there was one other. Do you remember the other one, Crystal? Where this was particularly the case, I guess. This is what we're learning. Again, this is, it's so hard to get information, and some of this is just anecdotal, and we're trying to figure out ways to corroborate it. But what we're hearing is that there was a lot of movement from the counties into spaces in the state prisons of some of these jail inmates.
Yeah. Yeah, no, absolutely. Yeah. And we absolutely, I think, can do our best to find ways to corroborate some of the anecdotes. I have 2 public defenders in mind that I think would be really, really helpful to your research. So we'll just connect when you can, and we'll figure out. I appreciate also the distinction that you raise around, right, the pretrial detainees being released and a lack of release or refusal to release inmates who are serving sentences for low level or nonviolent crimes. And I'd love to talk with you more about the beginning of the presentation where you were mentioning sort of, the trend down from 2008 to 2018. Just around incarceration rates generally, and that we see that Black males are the largest percentage of those being released. We had Paul Butler at the law school, virtually, of course, maybe a month ago, and he talked about prison abolition and how, as a country, we need to really start to think about the reasons why we have people in prison, and if we think it's to keep us safe from violent offenders. That even violent offenders are finding, their sentences for the most part are 8 years. I think he said the average violent offender sentence is 8 years, and that we aren't doing anything. Our prison system does nothing to actually ensure that people are quote unquote safe when people are released, right? And so some really interesting conversations. As you might imagine, people in the chat were alarmed about this notion that violent offenders might be released as a part of the decarceration, as a part of really making some strides towards decarceration. And those conversations just are not easy, right? To get people to understand that if we're serious about tackling the problem, we're talking about more than just people who have drug addiction issues. We're just now getting to the place where drug addiction is the thing that we believe isn't worth being incarcerated for, right? And so I applaud your work. I'm thankful for this presentation. And I guess I said all of that to say, I recognize that we still have a long way to go.
Yeah, I appreciate that. But, I think this is the new frontier, right? Is figuring out how we can reduce the period of time that violent offenders are in prison. We need to look at that. I mean, we have to focus, the conversation has to include public safety. And as you said, this may require us to reconceptualize what it means to detain and contain, right?
Absolutely, absolutely, absolutely. And having that imaginative, right, having that imaginative ability is the only way we'll be able to transform, right, what we've created. I love the other thing that you said, and I just want you to know that I'm going to quote you on it several times, the period of disgrace. I think that is a really good way to capture what happened from the mid 1970s until 2008.
Other comments and questions? We have about 5 minutes, I think, left. Okay, well, so if you are interested in continuing this conversation, getting involved, you can reach me at in the Department of Sociology, or timothy.black@case.edu. Crystal and I are going to continue this work, and we're looking for partners. And we think students and faculty need to be, creating some coalition work with people who are advocates and doing the work on the ground and so forth. And so I think what we're trying to do is start a conversation or become part of a conversation, I should say, and try to push that from this institutional perch that we have here, where we have some resources and perhaps some power to begin to contribute to some of what's being done around what I think is such an essential issue.
Thank you so much, Tim. Yeah, this is perfect timing. Our hope was that we would have 5 minutes in between each session so that people could do bio and stretching breaks. And then at 11, we have Claudia Colton presenting on redlining. And so I hope that many of you who are a part of this session will toggle over and join us for that presentation. Thank you so much. I really appreciate both of you presenting.